I want to introduce a fantastic physiotherapist that I work with, and her name is Shira Kramer. Shira was great in that I actually went to her and got my pelvic floor ultrasounded. And may I suggest that every person that wants to talk about pelvic floor, you need to do this. It was very enlightening for me, and I guess I did it because I just wanted to make sure if I knew what I was talking about. And Shira was fantastic. So we'd start off with lying down in the bed first.
Yeah, so I had Marietta lying on the bed. I took the ultrasound probe, and it's totally non-invasive. It wasn't too scary, was it?
No, it's just like on your tummy, like here. So it's not.
A little bit of gel. The lower abdomen's exposed. We put the probe just underneath the belly button and have a look and see the bladder lift and lower as Marietta's trying to contract her pelvic floor. What do we see?
Actually, a really good one. But the thing is, what she did really well was describe where my layers of abdominal tissue was. So like got to see different tissue. Then it's like a sort of a darkish matter, which is the bladder, isn't it? And then underneath it's the pelvic floor, and you're able to see it.
That's correct. So you come in with a full bladder essentially, and on the screen you see a black round structure, and that's the bladder, which is filled with water. As we know, the pelvic floor sits underneath it. So when Marietta's lifting her pelvic floor on the screen, ideally we see the floor of the bladder lift up towards the top of the screen. So that's a healthy pelvic floor with a good contraction.
What was really interesting was we decided to play around with some different exercises just because we had the time and we had lots of gel. So we did an abdominal curl, and actually I didn't do too badly with the abdominal curl. There was a little bit, like you can see on the pelvic floor what it's like on the ultrasound, what it's like when you do a good contraction, and then it becomes quite visible. What Shira did was she used the cursor so we could see where a good lift was and when I wasn't achieving the same lift. And we did a cough. So I coughed. That was funny because the first time I coughed, my pelvic floor went right down. So it was like, ugh. And then she asked me to lift my pelvic floor. It became a bit more like a, but I cough a lot better now. And then we did a squat, and that was actually really interesting because when I did the squat, what Shira did was she asked me to do a strong lift. So I did that. And then I descended into the squat, and it just dropped away.
So you see the bladder descend down to the bottom of the screen, which is not correct, not ideally what we're looking for. We're looking for an elevation or at least a maintenance of the position of the bladder with the deep squat, with the squat on the ultrasound. So we weren't too happy with the squat.
No. And it was actually a little bit tricky because she asked me to lift it, and then I was doing all the things that you shouldn't be doing. Squeezing my backside, clenching up my inner thighs, using every facial muscle I could possibly imagine, which is not effective at lifting your pelvic floor.
So in this situation where we have Marietta, who's a fit, healthy, strong trainer, on the outside may appear that she's doing the squat beautifully or any other exercise, but in fact when we have the ultrasound on, we see that there perhaps is a weak link where the pelvic floor is not quite in an optimal position for that exercise.
And I think what really taught me as a fitness professional was like how it can weaken so quickly. Like any pressure, any movement, any weight can actually make a big difference. Probably one of the things that we need to discuss is about how instructors try to cue like abs, for example. And probably some of the favourite cues would be
suck it in, brace.
Activate your core. What else do they say? It's that sort of stuff that sort of makes people do the inappropriate action, which is they tend to suck in, push down, try like stiffen up everything, and it's almost like
I think the fact that often the emphasis is on stabilising and getting the core active, that's fantastic, but I think at times perhaps it's emphasised in a way that causes participants or clients to over-recruit the wrong muscles of the abdominal wall and the pelvic floor.
So I think that, some of the cueing methods that we suggest is, talk about, once again, pelvic floor first. You want them to lift up their pelvic floor. What's some of your favourite analogies for that?
Yeah, so gently tightening back and front passage. I like the aeroplane taking off from the back passage to the front and it's going up and forward into the skies.
Well, that's cool. I think I got that just then.
You like the strawberry milkshake.
And to be honest with you, I actually got it from one of the classes, the pregnancy classes I went to. So that's a great place to get some tips for pelvic floor activation. But the thick shake works for me.
Holding, also talking about holding in a tampon, or just a gentle elevation around back and front passage if you don't want to use those other words.
When I think about pap smear, I always naturally withdraw when I think of a pap smear, because I think of that thing that they're going to stick in. So I have this like drawing away effect. So that might be another analogy that you use. In the end, you actually need a library of analogies, because different things are going to appeal to different people. But what you want to start eliminating from your vocabulary: bracing, tightening, stiffening, activating, because that tends to stimulate the wrong responses.
Yeah. And it's the same thing really with the abdominal muscles, where we're looking for a gentle, about 20 to 30% activation of the transversus, or the deep abdominals. So in front of a class, cueing more about gently setting your core, or gently drawing your lower abdomen rather than brace.
Yeah. And when I did my ultrasound, that was one of the things that we picked up straight away, was that when she asked me to, activate my transverse abdominis, it was like, just went nuts. It just over-activated way too much. And I think that comes from this fitness industry ideal of that you need to really pull in really hard.
And often I do see, highly fit clients or people within the fitness industry who have done lots of global muscle work, lots of abdominal curls, lots of oblique work, and they find it very difficult to then tone down the deep abdominals, because the outside abdominals are really overactive, and that's really evident on the ultrasound, where the layers of internal and external oblique are quite thick and transversus is thinner, and it becomes quite a challenge to try and tone down the overactive muscles and relearn the pattern of gently activating the deep stuff, which is what we need.